Hi dear friends. Namaste. Salam alaikum. Durud. Hole. How are you? How was your day? I hope you enjoy with your days and get many experience and knowledge from day to day. Okay, dear friends, I came back again for another class today. Thank you for watching me and thank you for supporting our classes by sharing with your friends. Thank you for subscribing us in our YouTube channel, Leila Mom Center LMC. I get too much motivated when I see your messages and when I see how you are sharing our classes. So I get more energy to come back every day to you and bring some new experience, knowledge, or evidence-based topics. I had some messages from some of midwives and doula friends. They were asking me, in some countries, we have many issues that we cannot provide them with good care in antenatal care. Some countries, as you know, in some Asian countries, some developing countries, they have many issues in their preconception care. Yeah, we have to work on preconception counseling as midwife. As you know, a new WHO reports that preconception care has a positive impact on maternal and child health outcomes. Yes, and address primarily at health professions responsible for developing national and local health policies. The report provides a foundation for implementing a package of promotive and preventive curative health intervention shown to have been effective in improving maternal and child health. Thank you for waving. So, we need a wide and big range of sectors, midwife, stakeholders to engage and make this universal access to preconception care. As you know, there are many reports that shows and try to guide non-health sectors, foundations, and civil society organizations to collaborate with and support public health policymakers to maximize gain for maternal and child health through preconception care. But what is preconception care? I don't know, in some countries, for example, in countries that I have experience to work in that, for example, in some Europe countries, we have some primary healthcare centers, or in some countries like Iran, before marriage, we have some governmental courses for couples who going for marriage test. They have to attend these pre-marriage counseling classes and get approved by government that they are competent to marry and they know how to prevent these damages. Plus, we have many private clinics in Iran that running with midwives. They call it pre-marriage counseling. There is a different counseling in those institute, in those classes that running by midwife. That is, one is talking about this physical, psychological issue, and some psychologists will join in these teams to provide different psychological and psychiatric problem that maybe they will find in the couples, and they have to detect it before marriage. If they find some issue in couples, they won't approve them to get the certificate for marriage. But in some countries, still this is not happening, because we have many countries in Asia and some developed countries that still they don't have these policies. So we have a very big role and job to provide this pre-marriage counseling for all of the new couples. Plus, if somebody are married and they want to try for conception, we can try to arrange preconception care for them. But what is preconception care? Preconception care is the provision of biomedical, behavioral, and social health interventions to women and couples before conception occurs. It aims at improving their health status and reducing behaviors and individual and environmental factors that contribute to poor maternal and child health outcomes. Of this preconception care is to improve maternal and child health in both the short and long term. It can prevent and control diseases that occur at multiple stages of life. Strong public health programs that use a life course preconception from infancy through childhood and adolescence to adulthood are needed. It contributes to these efforts. Even if preconception care aims primarily at improving maternal and child health, it brings health benefit to the adolescents, women, men, and irrespective of their plans to become parents. We have a very big role in every country. As I told you, as a fact, 4 out of 10 women report that their pregnancies are unplanned. And as a result, essential health intervention provided once a woman and her partner decide to have a child will be too late in 40% of pregnancies. We have many issues, maternal undernutrition like iron deficiency, anemia, or some other countries they have nicotine and tobacco use. It increased risk of maternal death, accounting for at least 20% of mortality, maternal mortality worldwide. And you know, in 2010, this is a WHO report that unfortunately 58,000 newborn babies died from the neonatal tetanus. And we had 15 to 55% neonatal death. Even prenatal deaths are 50% higher among children born to mothers under 20 years of age compared to the mothers aged 20 to 29 years. Imagine mass population of the rural area girls that who get pregnancy are less than 20 years. And I was engaged in some project for some villages even in India and some other countries. Unfortunately, we had most of pregnancies less than 20 years, and all of these deficiencies we will find in there. Prenatal deaths are 50% higher among children born to mothers under 20 years of age compared to mothers aged 20 to 29 years. because of these deficiencies, because of unaware couples, because of many others issues like not done vaccination, they haven't done even get nutrition, good nutrition enough. Then this is the things that it is real happening in this population, and many population are engaging with that. Up to 35% of the pregnancies among women with untreated gonococcal infection result in low birth weight, infant and premature deliveries, and up to 10% result in prenatal death. Sometimes even in some developed countries, I found we have many gonococcal infection in mothers and even in the father. They haven't done tests and no screening. And sometimes in some developing countries, I've seen even the girls or mothers, they haven't done any simple gynecological test before their pregnancy. How we detect these infections? It is the midwife role to explain to them in preconception care how to do every 3 till 6 months gynecological screening. It is needed for a woman, and men should be well trained to know the symptoms of infection in their genital. And we have many other issues like physical, psychological, and reproductive consequences after HIV infection, and it causes many big risks for low birth weight as well. This all will be detected and will be investigated before pregnancy, and we will find these infections. Even we have many issues with the mothers and women with epilepsy, that they have increased risk of having baby with congenital abnormalities. Plus, mothers who are smoking before or during pregnancy could get around 5 to 7% preterm labor, and they will have 23 to 24% of sudden fetal death syndrome. This is the importance of preconception counseling. I don't want to talk that much about details. I will try to continue explaining in next class because we have a limited time for training, and I have to translate in Farsi because I think a small short Persian I can tell to friends. And next class I will tell you which test and which screening we have to do for this preconception care. Thank you so much for following us in Facebook channel, in our YouTube channel, Leila Mostofi LMC. Thank you for subscribing us and sharing with your friends. Your message, all of your direct suggestion and feedback, motivating us to continue our classes with you. Please write your comment and suggestion. What you like we talk about, what is your issue, and which training you like we go through that in our next contents. دوستان عزیزم، در ارتباط با این صحبت می کردیم که چرا بسیاری از خانم ها وارد مرحله اول بارداری میشن ولی بسیار مسائل زیادی درش درگیر هستن که میتونستن برای اینها قبل از بارداری چاره ایجاد کنن که در دوران بارداری با عدم آگاهی سراغ ما نیان. و وقتی پیش ما در دوران بارداری میان که خیلی از همین مادران اصلا نمیخوان مراقبت‌های بارداری دریافت کنن چون آموزش کافی رو ندیدن. در بعضی از کشورها مثل ایران ما قبل از اینکه خانم و آقا ازدواج کنن دوره‌ها و کلاس‌های مشاوره قبل از ازدواج براشون ضروری هست توسط دولت که بگذرونن تا بتونن از لحاظ روانی، فیزیکی و لحاظ جسمی بررسی بشن که ببینن آیا اینها آمادگی ازدواج رو دارن یا نه. و قبل از اینکه بخوان باردار بشن تا 3 تا 6 ماه باید مراجعه بکنن تا از لحاظ مسائل کامل پزشکی، روانی و فیزیکی بررسی بشن، عفونت‌ها، مشکلات روانی، مشکلات ژنتیکی، که این بارداری و بچه‌شون با مشکل ایجاد نشه. همونطور که میدونین 4 تا از 10 تا خانومی که دیده شده بارداری هاشون آنپلند بوده، بدون برنامه‌ریزی بوده و متاسفانه خیلی از اینها باعث میشه که ما اینترونشن های غیر ضروری داشته باشیم و بچه‌هایی به دنیا بیان که بچه‌هایی با مشکلات زیادی تا 40% براشون این مشکلات اتفاق میفته. مسائل خیلی مهمی مثل عدم تغذیه، یعنی تغذیه های اندر نوتریشن ها، تغذیه های غیر زیر خط استاندارد و فقر غذایی یا کمبود آهن در این افراد خیلی دیده میشه. کمخونی ها، اینها باعث میشه که تقریبا 20% مورتالیتی های مادری رو اتفاق بیفته باهاش. در سال 2010 58,000 نوزاد متولد مرده ما داشتیم به خاطر مشکلات تتانوس و نزدیک 15 تا 55% هم در لحظه بچه مرده داشتیم. خیلی از مرگ‌های دوران پرینیتال، دوران بارداری که حدود 50% هستش، برای مادرهایی هست که زیر سن 20 سال اینا باردار میشن و نسبت به مادرهایی که تو سن 20 به بالا هستن بیشتر هست، تا حدود 50% اونها بیشتر هستش. همچنین 35% حاملگی هایی که خانم ها با عفونت‌های گونوکوکال باردار میشن دارای بچه‌های با وزن کم هستن که 10% این باعث مرگ‌های پرینیتال میشه. مورد دیگه که هستش، در افرادی که مبتلا به HIV هستن، این عزیزان متاسفانه دریافت درمان کافی رو انجام نمیدن و باعث میشه که این انتقال از مادر، حالا به روش‌های مختلف یا به خاطر مسائل مختلف، باعث یه سری عوارض فیزیکی و روانی و حتی عواقب بارداری رو بده، مثلا زایمان‌های زودرس، پریمچور و بچه‌های کم هست. و خانم هایی که مخصوصاً اپیلپسی یا خانم هایی که سر دارن، این خانم ها در خطر بچه های با مشکلات کانجنیتال و آنومالی و مشکلات بچه های عقب افتاده خواهند بود. تخمین ها نشون میده که سیگار کشیدن در قبل بارداری و دوران بارداری میتونه باعث 5 تا 7% زایمان پریترم بشه و 23 تا 24% سندروم مرگ جنینی بده. پس با توجه به این مسائل ما چقدر خوبه که در هر جایی هستیم آموزش های پریکانسپشن رو داشته باشیم. حالا قبل ازدواج، قبل از بارداری، رفتن به خیلی از روستاها و گذاشتن یک سری امکانات آموزشی دیجیتال برای ممنون از اینکه با ما همراه بودین و امیدوارم که این برنامه ها براتون مفید باشه. خواهش میکنم اگر دوست داشتین کلاس های ما رو با دوستاتون به اشتراک بذارین و در کانال یوتیوب ما رو دنبال کنین، کانال لیلی مام سنتر LMC. Thank you everybody. I hope these small tips and this small midwifery skill can help us to develop all of the globes. In every part of the world we are belong to, we have a responsibility to survive some people. As you see, even we have in many issues in developing countries that they can come through their issues by a small training by midwife. Midwifery is not only treatment, is not only birth. Midwifery is giving training and knowledge to mothers, to new couples, and even for the girls they haven't decided to marry, to have this knowledge and then decide for marriage, because the consequences of lack of information will affect in their pregnancy, in their baby, and in their future of the generation. Thank you so much for following us. Please keep coming with us in our next classes and share with your friends. Thank you.